my name is Jewel. I am an occupational therapy student here at SCC, and today I'm going to be demonstrating how to do a sit-to-stand transfer using a stand pivot. I'm going to be using myself as an adaptive tool. So some indications, so why you would want to do this. So maybe your patient has some weakness in their legs, maybe they just came out of surgery and they're unable to acquire that balance that they need or that muscle strength that they need in order to transfer themselves. Also, some contraindications would include, so you wouldn't really want to do this if the patient is able to bear quite a bit of weight on their legs, but also someone who has functional mobility, you really wouldn't need to do this. Also, some diagnoses that would be prevalent in this, so like multiple sclerosis would be one. Also, like I said, if they had any surgery on their legs, you would also do it for cerebral palsy. Yeah, so I'm going to go ahead and begin. So the first thing that I want to make sure, I'm going to introduce myself to the patient and I'm going to let her know what we're going to be doing today. So hi, my name is Jewel. I'm from occupational therapy, and today we're going to be transferring you into a wheelchair. All right. So after that, I do want to make sure to wash my hands. It's very important before and after you're dealing with a patient. So I'm going to let my patient know that I'm going to go get my tools and we will get started. So I'm going to go get my tools really quick and I'll be right back. Okay. So over here, I'm going to bring in, I'm going to put this by the bedside. I'm going to bring in my wheelchair and my gait belt. My gait belt is going to be used to help me transfer her. It's going to assist me in lifting her, and then my wheelchair is where she's going to be transferring to. So for now, I'm going to go ahead and just put my gait belt here. And before we start, I want to make sure that my wheelchair is locked on both sides. We do not want this moving for safety purposes. I want to make sure that my foot plates are up and out of the way, and then I also want to make sure to swing the footrest out of the way so she'll be able to sit down without hitting these. Alrighty. And then just double checking to make sure this is completely locked. Perfect. Alrighty. Alright, so I'm going to begin. So again, you're going to be transferring into the wheelchair. I want to make sure that you are sitting completely at the edge of the bed with your hands, your palms touching the bed. I do want to make sure that you always have shoes on your patient's feet before you transfer them anywhere before they are standing. She does have shoes on, so in this case we can begin. So I'm going to take my gait belt. I'm going to make sure that the teeth are on the outside. And then I'm going to have her lift her arms. I'm going to feed this through. And I do want to make sure that this is pretty tight because we don't want this sliding up on her armpits. We do want to make sure that nothing happens when we're transferring her. It's very important, especially if I'm using myself as adaptive equipment. I'm going to tuck this in a little bit because it is quite long and it's just a little bit out of the way. All right. So we are ready to begin. So what I'm going to have you do, I'm not going to do it just yet. I'm going to have you make sure to push off on the count of 3. When you push off, I'm going to transfer you to this wheelchair, and then I'm going to have you reach back. I'll repeat that as we go. So, on the count of 3, I'm going to make sure that my legs are kind of like a barrier, so she's in between me. So I'm kind of playing the role of a walker. So, on the count of 3, we also body mechanics as well. You want to make sure that your back is straight and that your knees are bent. On the count of 3, we're going to get up and have you push from your hands. Ready? 1, 2, 3. Grab onto my arms, please. All right. And then we're going to walk you. I'm going to have you reach back for me. I'm going to have you sit And again, I did use myself as an adaptive tool. I made sure to do this because if you have any cognitive problems, it's best to use yourself in order to make sure that you have that safety, like almost 100% safety. So whatever feels safer for you is the best. If she were to have cognitive problems, then she would not be able to use a walker. And that is it.